Recognizing childhood trauma signs for healing. Recognizing childhood trauma signs is crucial for healing and leading a life of emotional and mental wellness. Please subscribe to our channel. Often, the symptoms of childhood trauma manifest subtly, influencing an individual's behavior and emotions deeply into adulthood. It begins with acknowledging that trauma can emerge from various events, not all of which are glaringly apparent. Abuse, neglect, witnessing violence, or experiencing a significant loss early in life can deeply impact a child's developing brain. One of the primary signs of childhood trauma in adults is the presence of overwhelming fear with no apparent cause. This fear frequently leads to anxiety disorders, which can paralyze an individual in social settings or new experiences. Another significant indicator is difficulty in forming or maintaining relationships. Trauma survivors may either cling too tightly, fearing abandonment, or distance themselves to avoid potential hurt. Trust becomes a battlefield, and imagining a world where they are safe with others seems almost impossible. Sleep disturbances, including nightmares and insomnia, are common among those with unresolved childhood trauma. These interruptions in sleep are not mere inconveniences. They're echoes of past fears and events replaying in the safest of spaces, sleep. Depression is a well-trod companion of childhood trauma. The persistent feeling of sadness, loss of interest in enjoyable activities, and a general sense of hopelessness can all be traced back to unresolved trauma. Furthermore, trauma survivors might exhibit extreme reactions to triggers that remind them of their traumatic experiences. They might be startled by loud noises, or a specific word could send them spiraling into panic. Physical symptoms, such as unexplained aches and pains, might also suggest the presence of unresolved trauma, as the body keeps the score of the mind's distress. Substance abuse and other harmful behaviors can be a telltale sign of someone trying to cope with the pain of their childhood trauma. By numbing themselves, they temporarily escape their haunting memories and emotions. However, this escape is fleeting and often leads to a cycle of dependence and further emotional turmoil. Avoidance behavior is another coping mechanism, where the individual avoids anything that might remind them of their trauma or elicit strong emotional responses. Low self-esteem often plagues those with childhood trauma. They may believe they are unworthy of love, success, or happiness, a direct message from their traumatic experiences. Manifested in adulthood, this can lead to self-sabotage in both personal and professional contexts. Victims might also struggle with identifying and expressing emotions, leading to emotional numbness. This detachment is a protective measure, an attempt to shield oneself from further hurt. However, recognizing these signs is the first step towards healing. Therapy and counseling can be transformative, offering a space to unpack the trauma under professional guidance. Techniques like cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR, have shown efficacy in treating trauma. Building a support system of understanding friends and family can also provide a sense of safety and belonging. Self-care practices, including mindfulness, meditation, and physical exercise, can help in managing symptoms and improving overall well-being. Journaling is another therapeutic tool, offering an outlet for emotions and thoughts that might be difficult to articulate verbally. Engaging in creative activities, like painting or music, can provide a non-verbal avenue for expression and healing. Ultimately, healing from childhood trauma is a journey of self-discovery and rebuilding. It requires patience, compassion, and resilience. Recognizing the signs is just the beginning. Healing involves confronting painful memories, understanding their impact, and learning to navigate life with renewed strength and perspective. It's about reclaiming the narrative of one's life, not as defined by trauma, but by the courage to overcome it. Thank you for watching this. Please like and subscribe.